Probably have a pretty easy time identifying the most painful sensation we've ever felt. It's the kind of thing that tends to stand out in your memory. Perhaps it was a broken bone, a particularly in-depth dental procedure, or a sports injury such as a torn muscle. Nobody likes to be in pain. That's why there's an entire medical field dedicated to pain management, and why anesthesia is a routine part of any surgical procedure, despite the fact that science doesn't exactly know how anesthesia works. But whatever your most painful experience was, the chances are high that it doesn't hold a candle to even the least painful sensation on this list. You may have seen a pain scale in the hospital or doctor's office, with 1 meaning no pain at all and 10 being the worst pain you can imagine. Well, you can pretty much throw that scale out the window, because the things we'll be looking at today render it worthless. They're the absolute most painful things you can experience. Pregnancy, labor, and childbirth are natural parts of the human experience, but bringing another person into the world is certainly no walk in the park. Most women who have delivered naturally, that is without having a cesarean section, will tell you that it's the worst pain they've ever faced, even if the end result is completely worth the ordeal. Labor and the pain of delivery are different for everyone, but the common denominators are the determination, stamina, and pain tolerance required to navigate the process. Some women describe the pains of labor as being very similar to menstrual cramps, albeit stronger than the strongest ones they've ever had. Others liken them to severe gas pain, or a kind of internal twisting, as if someone is having a tug of war inside their belly. The pain of labor tends to be strongest when the cervix becomes fully dilated, but even that is eclipsed by the pain of delivery, which is very intense and is often described as feeling like a ring of fire as the baby's head makes its way through the dilated cervix. And the icing on the cake, there's no time limit here. Labor and delivery can take anywhere from 4 hours to 24 hours and beyond. More than one entry on today's list has been described as the worst pain known to humans, and the infamous cluster headache is one of them. If the term doesn't ring a bell, you should be glad. Like a migraine, but far worse, cluster headaches are completely incapacitating, and have even been known to make sufferers contemplate suicide. The pain has been described in myriad ways. Among the more common descriptions are a white-hot poker jammed into an eye socket, a paper cut in the middle of your brain, or like being literally shot in the face. They're so named because the pain is localized on one side of the head, usually around the eye, and the attacks themselves usually occur in clusters over the course of a few weeks to a month. A family history of cluster headaches is the most significant risk factor, and if your family has such a history, you'll want to limit your exposure to tobacco and alcohol, as these are also known to bring on attacks. But as far as the actual cause, it's unknown. A number of preventative treatments have been shown to have varying degrees of effectiveness, including lithium, Botox, and deep brain stimulation, and a few drugs, including opioids, have been proven effective in at least diminishing the pain during an attack. But these headaches are colloquially referred to as suicide headaches for a reason. According to Dr. Mark Green, professor of neurology at the Mount Sinai School of Medicine, most doctors who treat the condition have had at least one patient who has taken their own life. The species Paraponera clavata is a type of tropical ant that inhabits the jungles of Nicaragua, Paraguay, and Honduras. You won't encounter them anywhere else, and for this we should all be thankful. These little critters are informally referred to as bullet ants, and it's not because of their shape. They have the most potent sting of perhaps any terrestrial animal on Earth, the pain of which has been likened to, you guessed it, actually being shot. Dr. Justin Schmidt, an entomologist and research director of the Southwest Biological Institute, wrote eloquently and at length about the pain of the bullet ant's sting for Esquire magazine. Says Dr. Schmidt, it was absolutely riveting. There were huge waves and crescendos of burning pain, a tsunami of pain coming out of my finger. The tsunami would crash as they do on the beach, then recede a little bit, then crash again. It wasn't just 2 or 3 of these waves. It continued for around 12 hours. It was absolutely excruciating. There wasn't much I could do except be aware of it and groan. The direct application of ice can alleviate the worst of the pain, but the second the ice is removed, the pain returns, and the venom can take up to 24 hours to run its course. Like many conditions on this list, complex regional pain syndrome is not very well understood, which of course makes treatment somewhat of a hit-and-miss proposition. The condition usually starts in one limb, and almost always occurs after injury or surgery to the site. But the pain experienced by sufferers of this syndrome is far out of proportion to the event which caused its onset, and that's not even the worst part. Although the pain manifests near the site of the injury, it can spread across the affected limb or even to other parts of the body. The pain has been described as stabbing, grinding, or throbbing, and the affected may also experience symptoms including including localized swelling, extreme sensitivity to touch, changes in skin temperature, and if left untreated long enough, thickening of joints, muscle atrophy, and the actual softening and thinning of bones. Moving the affected limb or limbs can become absolutely intolerable, and affected limbs can become totally immobile or even displaced from their sockets. Treatments range from physical and occupational therapy to conventional pain relief with drugs such as ketamine, and are most successful if the condition is caught very early on. Spinal cord stimulation has also proved to be a moderately effective treatment, but once the disease has progressed past a certain point, the only viable option for treatment becomes amputation. The peritoneum is a membrane which lines the inside of the abdomen and all of the internal organs, and like all membranes, it can become inflamed. This usually happens due to a bacterial infection or some kind of irritant, such as an overflow of stomach acid or bile from the gallbladder, and it results in the condition known as peritonitis, which can happen on its own or as a secondary symptom of another underlying condition. Peritonitis is fairly easy to diagnose. The patient will have a high fever and pain in their abdomen so intense as to make even the slightest movement nearly impossible. Upon diagnosis, a laparotomy, a surgical incision into the abdominal cavity, is typically performed in order to assess any damage that may have been done to the internal organs. Any such damage will typically be repaired at this time. Like most severe infections, peritonitis is treated with antibiotics and IV fluids to prevent dehydration. And of course, early diagnosis is key to resolving the condition quickly. Left untreated, peritonitis almost always results in death, but only after hours upon hours of the worst pain the patient is likely to have ever experienced. The Sinansia, or stonefish, is a master of camouflage. It's so named because of the manner in which it captures its prey. It will wait patiently on the ocean floor, disguised as a mossy rock, waiting for an unsuspecting victim to swim by. When one does, it strikes without hesitation, and if its victim is lucky, it'll only be swallowed whole. Out of the 1,200 or so species of venomous fish in the sea, the stonefish possesses a sting that is not only excruciatingly painful, but can also be lethal. The stonefish has 13 dorsal spines which are capable of piercing human flesh and delivering venom deep into the tissue. One Australian man who has experienced the sting said, "I guess I could best describe the pain as holding an oxyacetylene torch to your foot, and then working its way up your whole leg over an hour or so, then smashing your leg with a sledgehammer every 10 seconds. Fortunately, treatment is fairly simple. Antivenom can be used, and if none is available, hot water poured directly onto the site of the sting will destroy the venom with little discomfort to the victim, as the pain of having hot water poured onto your skin is far exceeded by the pain of the sting. But you'll want to act fast. Left untreated, the sting of the stonefish can kill a full-grown human within 1 hour. Scaphism is not a medical condition. Rather, it's one of the most bizarre and sadistic methods of execution known to man. Employed by the ancient Persians, the technique was presumably reserved for the worst of the worst criminals. But then it's tough to imagine anything that anyone could do which would merit such a punishment, because the punishment itself is more twisted than virtually any crime anyone is capable of. It works like this. The condemned is force-fed engorging amounts of milk and honey, then also covered with both substances, with particular focus on the mucous membranes and other sensitive areas. Then they're sandwiched between two identical rowboats, with their arms and legs sticking out, and set adrift on a pond. Eventually, the force feeding will result in, shall we say, explosive defecation. And the combination of this, along with the milk and honey which has been slathered on the victim, will draw all manner of insects and vermin, who literally begin to eat the victim alive. The punishment was sometimes even prolonged by repeated force feedings, which could prevent death from dehydration or starvation in favor of the desired cause of death, septic shock. If there's ever been a more deranged and brutal method of execution, we can probably just go ahead and live out the rest of our lives without knowing what that is. Most people in the developed world have never had to experience tetanus, also known as lockjaw, because a vaccine has been available and routinely administered since the late 1940s. But before this time, it was one of the most dreaded diseases in the world, and with good reason. Tetanus is caused by foreign bacteria which usually enter the body through a cut or other wound. These bacteria produce a toxin that causes extremely severe muscle spasms. So severe, in fact, that there are documented cases of sufferers breaking their own bones and tearing muscles while in their grip. Depending on the severity of the condition, tetanus can also cause difficulty in breathing, which can be severe enough as to require mechanical ventilation and even cardiac arrest. The disease can be treated with antitoxin and muscle relaxers, but with or without treatment, fully 10% of tetanus infections prove fatal. Those fortunate enough to survive can look forward to months of enduring horribly powerful muscle contractions, which can result in a whole host of systemic issues once the infection is resolved. So please, make sure to stay up to date on those vaccinations. Anyone who has ever suffered substantial third-degree burns will tell you that there are few sterner tests of one's will to survive. There are many different ways to sustain such burns other than exposure to heat or flame. Certain chemicals, electricity, and radiation are all capable of producing them. But regardless of how they're sustained, burns take a very long time to heal. And during this time, the patient will be suffering from insanely intense pain from which there is no escape. Third-degree burns are those which penetrate through all layers of the skin, affecting the muscle and tissue underneath. The exceedingly rare fourth-degree burn category also involves damage to the bone. While first and second-degree burns can be treated with pain-relieving medication or topical cream, the most common treatment for third-degree burns are skin grafts, using either real or synthetic skin. The types of pain caused by these injuries can be wildly varied and unique between patients, so an aggressive pain management strategy is required for patients who have sustained them. The long healing time and need to constantly redress the affected areas are also among the factors which make severe burns one of the most challenging and painful injuries to recover from. The trigeminal nerve is one of 12 nerves connected to the brain and is one of the most widely distributed nerves in the head. It's not clear what causes the condition known as trigeminal neuralgia, or TN, but the symptoms, short electric shock-like bursts of pain throughout the face which can recur for hours or even days, are so painful that TN has come to be known by another name, the suicide disease. TN is not fatal, but many of its sufferers wish it were. Its effects can be totally incapacitating, and episodes can be triggered by such mundane things as talking, chewing food, or even the wind blowing on the affected areas. As if this weren't horrifying enough, the disease is often progressive, meaning that attacks worsen over time. While there are an array of treatment options, they're only moderately effective, and their efficacy varies from patient to patient. There's no surgical option for treatment, except one, which is completely effective in relieving the pain of TN, damaging the nerve itself, cutting off the pain signals it sends to the brain. Of course, the unfortunate side effect here is that the patient will lose all feeling in his or her face, but if it's a choice between that and a lifetime of ever-worsening blinding attacks of pain for the remainder of their lifetime, most if not all patients would gladly choose the former.